Hi everyone, welcome back. In today's video, I'm going to talk about suctioning. It is very important as a nurse to know how to suction a patient because you will be taking care of patient who has respiratory problem, and some of them will have a lot of secretion and that. So it's good that you know how to do it. And if you don't know, you will have to find someone in the field on your floor or your supervisor to help you with that. But having a basic about suctioning, and this is very important to watch this video. Okay? So to start, let's talk about the reason why you have to suction a patient. We suction a patient mostly when the patient has secretion. Secretion can be different types. It can be blood, saliva, vomit, and other kind of secretion. We clean the secretion to help the patient breathe better. Because sometimes it's suctioning can be very, let's say, like when a patient has too much secretion in the airway, sometimes it could be life threatening. If you don't suction the patient, certain patient required you to suction required to be suctioned in order to breathe, and the breathing is what keep you alive. So before you start suctioning, it's very important to check the chart, because some patient has an order to be suctioned and some of them don't. Mostly if it's your first time, if it's the first time you're going to suction the patient, it's good to see if there is any contraindication before you suction that patient. So that's why it's good to check the chart to see if there's any note from the doctor. In their situation, you will not have to look at the chart, because when you have to suction a patient and if the patient life depend on it, you have to do it. You don't have to wait for respiratory to come and suction the patient unless you don't know how to do it or you've never done it. If you've never done suctioning, it's very important to look for help. Call the respiratory therapist, or call even you. I could tell you to call your charge nurse, but the best person to teach you how to suction is respiratory therapist. Okay? So it's also very important to wash your hand before you suction a patient to avoid any kind of cross contamination. You will have to wear gloves. First, I would say when you finish checking the chat, you will have to make sure you can just go to by the door, like to the room, and check to see if the patient is there. Then you go to the equipment room, you gather all your equipment. Okay, you gather all your equipment, and also while you go check if the patient is there in the room, because sometimes you might have a discharge for the patient and you might not even know it yet. So it's very important to check if the patient is there before you go get all your equipment and stuff. And while you're checking if the patient is in the room, it's also good to check to see if there is a suction setting on the wall, because most of the hospitals, they don't put all the suction, like for example the canister and all that, on the wall until, mostly if it's a new patient, the wall might not have everything that you need. So you will have to set up the canister by yourself. If you don't know how to do it, it's very important to ask for help. Okay? First, you check the chat. You check if the patient is there. You check the wall, the wall to make sure the canister, everything is there, and you gather your supplies. Then you equip if it's a if it's a regular room, you go ahead and do what you have to do. But if it's like if it's a room that required you to wear everything, gown and stuff, you wear everything you have to wear, and then you go to the room and you set the suction pressure and all that. You have to make sure you check to see if the suction pressure, the pressure that is coming from the wall, you have to make sure that it's working. This is also very important. Then you will need to get a clean suction catheter. They will come in a little kit, most of them, and you will have to open them. Make sure you don't get a suction catheter that is already used. If it's open, that means it's contaminated, it's not clean. You will not have to use it. You should never use it. You have to put gloves all the time. Never suction a patient without your gloves on. Okay? And before you suction the patient, in order for you to suction the patient, you have to connect the turbine to the canister. So you have to know how to learn, or you have to learn how to do all that. Then you will have to look at the patient before you start suctioning. You look at the patient. You will have to raise the head of the bed in semi-Fowler. I would recommend 35 to 45 degree, depending on the patient. Then you will have to pre-oxygenate the patient. Very important. The reason why you have to pre-oxygenate the patient is because while you're suctioning the patient, not only you're removing secretion, you will also removing oxygen. That's the reason you have to pre-oxygenate the patient before you start suctioning the patient. And also, when you put the patient head up 35 to 45 degree, you pre-oxygenate the patient, and then you will have to tell the patient what you're about to do. Very important. Even the patient is unconscious, sometimes you might see the patient look unconscious, but the patient might still be able to hear you. So always talk to the patient before you start any kind of procedure, any kind of like suctioning or cleaning the mouth and all that. You will have to talk to the patient to let the patient know exactly what you have to do. If that patient is able to cough, it's also, before you even start suctioning, it's good to encourage the patient to cough, because sometimes you might not need to suction a patient who is able to cough, because when you cough, you're pushing the secretion out. It's mostly the same thing the suction is doing. You suction when the patient is unable to cough. But even though sometimes the patient might be able to cough, but if the patient has copious secretion, if it's too much secretion, the patient will still have to do both. The patient will have to cough, and also you will still have to suction the patient. Okay? While you're suctioning, it's good to do it in a circular, like you are doing a circle when you're applying the pressure. You don't apply the pressure while you're going down. You will apply the pressure while you're coming out. Very important. This is also a state board exam question. Almost everything about suctioning is part of the Nclex. Very important. Let me say it again. You have to suction. When you're suctioning the patient, you don't apply pressure while you're going down. you have to apply pressure intermittently, like you press and open, you put your finger on top of the hole that is on the catheter. If you're using an open suctioning, if it's a closed suctioning, it's a little different. Because I will tell you at the end, maybe within, I'll tell you exactly what is the difference between a closed and an open suction. So you're going on a circular motion, and then you apply pressure while you're coming out. Okay? And you should not suction the patient for longer than, I would say, let's say recommended is 5 to 10 seconds. When you're suctioning a patient, you will suction the patient in 5 to 10 seconds. But sometimes you might find a patient, you might have a patient that is required more suctioning than you were planning to. For example, the patient has a lot of secretion, 10 seconds might not be enough. So what you would have to do, you will have to pre-oxygenate. Not only you pre-oxygenate at the beginning, you will pre-oxygenate while you're doing it. You're going to have to take a break between suctioning. You will take a break. You will give the patient a break. Okay, you take a short break so the patient will feel better, and then you pre-oxygenate, and then you start suctioning again. So if you have to suction for more than 10 minutes, like 15 seconds is the highest, you will have to pre-oxygenate the patient within the suction, like before, while you're doing it, and after you finish it. Okay, very important. While you're suctioning, also, you will be using normal saline. Remember, normal saline is what you will be using to suction the patient. You can put some of the normal saline to the either in the if you're doing a trick, if it's a deep suction, it's good to use a little normal saline. But there's the thing. The bud, in some of the books you will see they had a new requirement, you should not use saline. Even they say you should not use saline, but we still use it. In every hospital they still use saline because this is what you use to help the secretion, to loosen the secretion. That's why we still use the saline in the hospitals. Okay? Yes, that's what like I said, you have to give pre-oxygenate the patient and all that. And one thing I forgot to tell you, before you start suctioning the patient, it's very, very important that you do a vital sign. The reason why you have to do a vital sign, because you need to know the difference between before you start suctioning and during and after. Because if you have a patient that is, like, for example, you listen to the patient long, first you have to take the heart rate. It's good to keep, if you have a monitor, you keep the patient on the monitor while you're suctioning, because if there's any change in the setting, in the breathing, or in the heart rate, you can see it right away. And the monitor sometimes will the alarm will come off. The alarm will come off. So that's the reason it's very important that you keep the patient on the monitor while suctioning the patient. And if you don't have a monitor, it's good to have, the small portable pulse oximeters. It's good to have one in your pocket also, because you can, check the patient while you're suctioning the patient. Yeah, vital sign. When you're doing vital sign, you will listen to the lung. In all 4 quadrants, you're gonna listen to the upper, lower, both upper lungs, both lower lungs, and then you go into the back and do the same thing. There's a pattern in all for you to assess the lung. It's very important that you know it, because you might have an image in the board that asks you which side that you have to place the stethoscope when you suction, when you assessing the lung. So it's good to know them. Okay. So you do vital sign, you listen to the breath sound, you check the oxygenation, the saturation, the heart rate, respiratory rate. When you finish, if while you're doing the suction, if you feel like the patient is turning blue, mostly that happen a lot in babies, in kids, while you're suctioning them because you are removing oxygen also, the patient might turn cyanotic. So if you see the patient turn blue, you have to stop the suction and place the patient on oxygen. Very important. Mostly with babies can change on you in a second. Adults are easier than kids, but the kid might be very stable, and in a second you might have a code. So that's very, very important to oxygenate the patient, mostly kids. Sometimes you suction, while you suctioning the kids, you keep the kid. There's a certain way we keep the, if it's a trach kid, if that kid is has a trach, there's a way we keep the oxygen. We keep the oxygen on while suctioning the kid. If it's an adult, depend on the severity of the disease, depend on the patient state, you might have to do it the normal way. But sometimes when you have a patient like ICU patient, ventilator patient, sometimes it's good to make sure you keep the patient on oxygen while you're suctioning. So you see, there are things you do in the state board and stuff you do in real life that are totally different, because sometimes you have to do what is best for the patient, and you have to make sure you protect your license also. You don't want a patient to code on you, because that's the worst feeling ever. While you're suctioning, okay, let me tell you, I forget to tell you, when you're listening to the lung, sometimes you will hear crackles. When you hear crackles, very important, crackles. When you hear crackles, that means the patient has secretion in the airway that need to be removed. Okay? Crackles is water, secretion, liquid. So each time you hear crackles, that means the patient needs suctioning. If the patient has a clear lung, if you don't hear no crackles, no wonka and anything, you don't have to, you might still have to suction if it's required. That's the reason if you see in the state board that they tell you you have to suction like every 3, every 4, 5 hours, you should not pick that answer, because suctioning should be as needed. As needed. You suction the patient only if the patient needs to be suctioned. Because you might see in the chat that you have an order to suction the patient every 6 hours or every 4 hours, even though we still have to use the common sense. You will not suction a patient because the patient has an order to be suctioned every 4 or 6 hours if the patient is not required, is not required to be suctioned. You will listen to the patient, and then you will determine if that patient needs to be suctioned. Sometimes you don't even you don't hear the patient just by passing by the door. You might hear the secretion is so loud, so you will know that patient needs to be suctioned. It's mostly the vent patients. So it's very important to know that. While suctioning the patient, you will be using, you can use Youngcobra. Youngcobra is it's like a mostly portable one. The Youngcobra, you can use a Youngcobra. That one you can suction the mouth with it. The Youngcobra is, you can change it every 24 hours or as needed. You see, you might see in the board that you should suction you should change the Youngcobra every 24 hours. But everything depends on your common sense. If the Youngcobra is not dirty, sometimes you bring the Youngcobra in the womb, the patient might not even use it. So you will not have to throw away. You will determine on your own if that Youngcobra need to be thrown away. Okay? And you can suction the patient with a Youngcobra. You can suction the patient with open suction. I will show you pictures about normally you will see Youngcobra everywhere in the hospital. So I will show you a picture between closed and open suction. Okay, not now. I will show it to you as we go to the notes. So you will be using you can use a Youngcobra. It's always good to have the Youngcobra for every respiratory patient. Every respiratory patient, you need to have a Youngcobra in the womb. Okay, you need to have Youngcobra in the womb. Even you still, and also you also have to have extra suction catheter in the womb always, because you never know when you will need it. Always have an extra suction catheter in the womb. If it's an inline, that one, if the patient is on a ventilator, it's also good to have an extra, because if the catheter is clogged, that means there's an obstruction in the catheter, you will have to change it. You will not have to, sometimes you don't have time to clean it because that will take too much time. You have to take care of the patient, so it's good to have an extra in the womb in case of emergency. Okay, extra Youngcobra, extra suction catheter, and then some saline. It's good to have some extra in the womb. Okay, so you can use a inline suction, open suction, or like a catheter, or a Youngcobra, and different kind of type of suctioning. We have oral suctioning. You have nasal suctioning. You see, also you have oral, you have nasal, you have deep suction, and you have nasopharyngeal. So the nasal suction is when you suction through the nose. We can say nasopharyngeal and oropharyngeal suctioning. And you can suction through the throat is when you're doing a deep suction. So nasal suctioning, oral suctioning, and deep suction. Okay? Very important to know the difference. Deep suctioning is when you're going through, you're gonna bypass the airway, you're going through the mouth. You can go through the mouth or you can go through the nose. That means you're going deeper than the upper. You're gonna bypass the upper airway, you're going deeper. So this is deep suctioning. You can do it nasopharyngeal, or you can do oropharyngeal. The nasopharyngeal also, we have an equipment, like if you have a patient that is like very delicate nose, you don't want to damage the patient nose. Like if you have frequent suctioning through the nose, you will use nasopharyngeal. You leave it nasopharyngeal airway. You leave it in the nose. That's what we call nasal trumpet. The nasal trumpet, please, you can take note and you can go through Google, and then you can Google nasal trumpet. Is one of the things you can leave in the nose while you have frequent, because, and also for nasal suctioning, you will need a doctor's order. Most hospital, you need a doctor's order for nasal suctioning. For oral, must maybe not, but nasal and deep suction, you mostly gonna have an order. So now let's go over complication, the most common complication while you're suctioning a patient. While you're suctioning a patient, you might It's not that you will, but you might have bradycardia. Bradycardia is not, if it's not an expected finding. It's not something you should be expected when you're suctioning a patient. What can be expected is mostly tachy, because you are removing oxygenation and the patient is agitated. You will have tachycardia, and you might have you might have tachycardia or tachypnea. So, but if you have mostly bradycardia, is because you've been stimulate the vagal nerve. It's very important while you're suctioning a patient, you try not to be rough. You have to be gentle, and you should not go too deep, like passing the carina and all that. You have to be careful not to go to the wrong spot, because if sometimes you might think you're suctioning the lung, and then you have the mainstream, you have the right stream. It's like the same like when they are intubating a patient. If you go to the wrong side, you will have a different lung sound. It might be silent. And also, while you're suctioning the patient, since you're going deep, you're going down with a catheter, there's a chance the catheter might go to the wrong way. So it's very important to be gentle, not to damage anything. If you see blood while you're suctioning a patient, please, you have to pull the tube back, and then give oxygen, a little saline, and then make sure you go gentle, because you will cause bradycardia. Okay? It's mostly when you stimulate the vagal nerve, and that can also cause the patient to faint, and the patient might even lose consciousness. So you don't want that to happen on your shift, on your hand, right? So that's why you have to make sure you're gentle to the patient. Do it like if you were taking care of a family member of yourself. Okay? And that can also cause a cardiovascular complication. So that's the reason you have to be careful while suctioning a patient. And like I said before, while you're suctioning the patient, if you see like the patient is restless, the patient is you have to, so for example, if you have to suction more than 10 seconds, you need to allow the patient to recover. Give a break, give the patient time to recover between the suctioning attempts. Okay? And then when you feel like the patient is ready for you to restart, while the patient is waiting, when you giving the patient a little time to recover, you will give a little oxygen, and then when it's time to restart, you will start suctioning. Just be careful, because some patient can get very bad on your hand while suctioning. And you also have to always monitor the oxygen level, the heart rate, the respiratory rate while you're suctioning. And also, it's very important to look at the patient's skin to make sure the patient doesn't turn blue on your hand. And make sure the patient is tolerating the process, the suction. Okay, here I was talking here's where we're gonna talk about different kind of suction equipment. Like we have open suction, and we have closed suction. Open suction is when the patient is disconnected from the ventilator, for example. Is a simple kind of suction catheter. You will insert into the endotracheal, okay, into the endotracheal tube. It's like it's not that long. It's let me see what size I would say. I don't have the way to measure it for you now. Okay, it's the open one is the one that you're gonna fold in your hand, and then you will put your finger on the suction hole to press, and intermittently to press each time you close the little hole. Let me see if I can find your picture. Each time you applying pressure, that's when you close the opening. And when you release your finger of the opening, there's no more pressure. Let's see if I can find you. Let me talk about closed suction first. So the closed suctioning is attached to the ventilator. Okay, the patient that are on closed suction are mostly ventilator patients, because we use closed suction because we trying to avoid cross contamination, and also to stop the patient from getting sick from by when you have a patient that has been there on the ventilator for a long time, and everybody will come like the morning shift or night shift or anytime the patient needs to be suctioned. Instead of keep reusing a catheter, or bringing new catheter very often, it's good to keep the patient in a inline suction catheter. That suction catheter is inside a plastic. No bacteria can get through it. Okay, so let me show you a picture. I'm going to show you a picture. And also, it's very important to change the suction canister every 24 hours as needed. Every 24 hours if it needs to be changed. Okay, and you have to lock the suction catheter. When you finish with the suction, there's a little button, you turn it to lock the end. Let me show you a picture. Okay, this one is like a regular catheter. This one you can do deep suction with it. You can do oral suctioning with it, and you can also do nasal suctioning with it. Okay, here you go. This one, it comes in a little package, in a kit. The kit might have, you see that little box right here? This is what you use. This is what you use to put the saline. And this is the gloves that you will be using. Okay? So this one is an open suction catheter. We also call it French catheter. So this one you can connect it to the suction line, and then you can not only suction the mouth, you can also if you required to suction the mouth, the nose, and the throat, you should never suction the mouth first. You hear me? You should never suction the mouth first, because the mouth has the most bacteria. So if you're gonna go to the nose and you have to suction, it's better you change catheter for each one. Okay? You should never go to the mouth first if you also have to suction the patient to the nose. And here we have an inline catheter. Let me enlarge it for you so you can see it better. Let me see if I can find another one. Okay, let's use this one. This is an inline. This one you see right here, it's attached to the ventilator circuit. It also has that little port you can put stuff like medication and stuff on it. Irrigation, like if you want to irrigate, you see the red part is where you irrigate the port with saline to do lavage. And then here you have the plastic that is cover the suction catheter. And right down here where it says thumb control, this is the thumb control. This is where you press. Each time you have to apply pressure, you will press this, and then you will apply pressure. When you release it, That means when you remove your thumb from it, the pressure will stop. Okay? So this is what we call an inline suction catheter. And the other one was an open one. So that's an inline, and it's gonna stay through the ventilator. Respiratory therapist is the one who's gonna change it when it needs to be changed. Okay? So there are a lot of things nurses don't have to care about. You just have to make sure. If it's dirty, you don't know how to clean it, you call respiratory. And if you would like to be like a nurse who can do almost everything, it's good that you not only when you call respiratory therapist, it's good, to see what the respiratory therapist is doing, or you can ask the respiratory therapist to teach you how to do it. Okay? So it's good like to know more than what you should have, because in case of a situation, you know how to do things. You don't have, if for example you call respiratory and respiratory is busy, so it's good to know how to do certain things. There are things you will need to know how to do. There are things you will need to know why they are being used and what they do for the patient. You see what I mean? So that's the reason you nurses need to know certain things about respiratory, because you need to know why the patient is using certain thing, why you're giving it to the patient. Because when the doctor call you to give you an order, you need to know why you're giving it to the patient. And sometimes the doctor might questioning you about certain things. So it's good to know. Okay? So this is all for today, guys. I hope you enjoyed the video. And if there's something you would like me to go over, please leave me a comment. Don't forget to give the video a like. That will help the algorithm, the YouTube algorithm, to help other people find the video in the feed. Okay? And you can share that video in your groups on Facebook. You can share it on WhatsApp. You can share on Twitter with your friend. Through you can share it. Okay? And don't forget to subscribe. When you subscribe, there's a little button. After you press the red button, there's a little bell that will show. You have to press the bell in order for you to receive all the notification. If you press the bell each time I'm going live, you will know. Okay? So thank you guys for coming, and I'll see you next time, okay, for next video.